So the diagnosis we're most concerned about right now is colorectal cancer. Colorectal cancer is one of the most common types of cancers worldwide, and it's when cells in your bowel or your rectum start growing out of control, and it can cause a lot of issues. So at this time, we want to do a diagnostic colonoscopy, just because it's been 12 years since your last colonoscopy, and on that one we found some polyps, which puts you at an increased risk for colon cancer. And then your symptoms are kind of classic ones that we see in colon cancer, like fatigue, iron deficiency anemia, and changes in your bowel habits. So the diagnostic colonoscopy will be able to see if you have polyps or even other abnormalities that could help us lead to a diagnosis. Some things we could see are sacs in your colon, creating little pouches, and that's called diverticulosis. Or we could see inflammatory bowel disease, which would help us be able to figure out what to do with your symptoms. So if there are polyps present, we can resect them and send them to pathology, which is what was done at your last colonoscopy. And this procedure is nice in a sense where we're able to diagnose and treat colon cancer, if that is what you have. So the procedure will use a flexible tube with a camera and a light at the end, and you shouldn't be feeling much at all or remember anything, honestly, because you'll be sedated or under anesthesia. So most people that I've talked to said that the day before is honestly the worst, where you have to go through this bowel prep and not eat any solid foods and just drink liquids. So hopefully the day of we'll be able to get you relaxed and comfortable and get it over with. Alternatives at this time are limited due to your concerning symptoms. There are alternative options for screening that we can discuss after your colonoscopy results, like a stool test to see if there's blood in your stool. And then also we can do a sigmoidoscopy, which is like a shorter colonoscopy. It only goes to your sigmoid colon instead of looking at the entire colon, or we can do a CT. And risk factors include infection and bleeding, which are risk factors for honestly a lot of procedures. Another risk is a bowel perforation, which is rare, but it's when the scope kind of pokes a hole through your bowel. But if this happens during the procedure, the surgeon's already there, you're in the OR, so he'll be able to fix it right up. And again, the benefits with this procedure, we're able to check a bunch of different things to be able to find out what's really going on and causing your symptoms. And we're able to cut out those polyps, which is part of the treatment if it is colon cancer. So that's why we need to get this done and make sure that we are focused on going to our future colon cancer screenings to make sure we prevent getting colon cancer and getting those severe complications such as like a bowel obstruction, continuous iron deficiency anemia, and abdominal pain, or cancer spreading to other organs.